This is Dr. Suze Burkhout dictating regarding patient Mr. Monsef Munir, spelled Moncef, last name Mounir, date of birth December 16th, 1989.
There was a brief idea. Run a warm bath, sit it out. Found my first aid kit to the sound of horror trap. The hip-hop played as the blood hit the floor. Made a hasty walk to the streetcar stop alone, crouched, hunched over like a vulture waiting. By that point, the resolve to see where this led, it was palpable, an obligation alongside vertigo.
Mr. Munir is a 30-year-old man with a history of psychosis as well as substance use disorder. He is followed in the community through intensive case management, and I saw him in my office in follow-up on September 26th, 2019. So, thanks for coming back. I wanted to check in with you about how you found last week.
Last week was a bit rough.
Monsef began our session today informing me that it was the 3-year anniversary of his abstinence from substances. Stop. He expressed in relation to this both pride and ambivalence relating to the length of time that he had been abstinent. Stop. He elaborated that the abstinence was challenging, and his ambivalence concerning it relates to the routine quality of his struggle to choose to maintain abstinence. And he referred to this as, quote, fighting a battle, end quote.
For the second time, I watched as my blood hit the floor. The tapping sound pierced the silence, similar to the typewriter that would soon enter my life and give birth to a series of vain print. Under fluorescent hospital lights, the future was stitched together again and another time. Through the looking glasses today, the sorrow leaves and enters. Stay the brief idea. And I've been dealing with my own sort of stuff coming into 3 years without any drugs or alcohol in my system.
Monsef identified themes of difficulty in sharing or opening up with others, as well as challenges and concerns regarding his limited ability to engage with romantic relationships, citing these as current stressors.
Same tune, different day, I say to myself, the only one capable, the only one seeing, critiquing the magnetism of force-catching swordfish submerging my legs. I kill the silence with dreams of Zanzibar.
I guess then there's a kind of learning that's happened for you.
Yeah. I've learned how to accept life as it is, right? Despite, me being, sexually abstinent for 11 years, or, something along those lines.
He elaborated that the abstinence was challenging, and his ambivalence concerning it relates to the routine quality of his struggle to choose to maintain abstinence. And he referred to this as, quote, fighting a battle, end quote. It's important to have the right kind of community around you to be able to make those choices.
Yeah, but community can be a difficult thing, right? Like, years back before I stopped using, I would had a double life within two communities and stuff like that. So it just as it's such a beneficial thing now, it can also be detrimental. A desire to be one with the women dancing. On stage, a button-up shirt with no nets for fish. I remember your hands on the couch, climax and laughter, ripping apart my American Apparel cords alone. She might one day wear this sexy disaster alone.
What's your mood like when you do open up to people?
I find it can be draining, and rewarding, depending on what sort of realizations I come to. Sometimes they're difficult realizations that aren't, that don't do anything positive for me until down the road when I've processed it. But then other times it's like, instant sort of, relief from some sort of guilt or shame or repression or whatever.
That there's that sort of a double-edged sword, it seems like, in a lot of aspects of your recovery.
Yeah.
Years later, wearing the creation I am misogyny, without my own paradise to be what you want, would the scars no longer exist? Bullshit. What did the world think would happen? An idle with assless chap showed me the way I wanted it all.
I guess one of the things that stands out to me is that I get the feeling that there's always this chance of slipping.
Yeah, but there's also, a good chance that I might never do a substance again for the rest of my life. So.
That said, themes of spirituality, internal coping strategies, including cognitive behavioral skills, and connections with his pet, were identified by Montsev as protective factors and ones that improved his quality of life and facilitated his ongoing recovery, period. You mentioned the sort of difficulty and the disappointment about not being in a romantic relationship. Do you feel like your interest in sexual activity is still there?
Yeah, definitely. And it's something that is hard to deal with, because it's like, as I begin to come to terms with my past and the sort of sexual experimenting that I did and the cross-dressing and everything like that, I start to love myself despite what it is that I do sexually and stuff like that.
New line. Screening for mood symptoms was unremarkable, period.
The Ebola of my lifetime drains, it spits the almighty dollar. Behind drywall, the dead machine teller, buyer, seller, spinach, cheddar, change. The Ebola of my lifetime drains.
That theme of having to work at it is there again.
Yeah, it's I'm starting to thrive in that sort of, though, it's still difficult, but the comfort zone and getting out of it, that space outside of the comfort zone has become so much more easier for me to navigate after 3 years without substances and 7 years in treatment for my mental health.
Indeed, the spirit like a cocktail, like a cock jail, buckets burying the man teller with lifeless automation, while captive to the shame in a casket he nails it, open and shut, checkmateless, cashed by the replacement.
How's your concentration?
It's been good, although I'm not sure if it's the best it's ever been. It's just the sort of lifestyle that I'm living, doing this job hunt and stuff like that, is sort of more conducive to a short attention span.
Would you call yourself a worrier?
Yeah, I worry. Not that I'm, always in a state of worry, but yeah, definitely.
What kind of things do you worry about?
What other people are thinking. That's a big one.
There were mild, overvalued ideas present in relation to thought broadcasting, thought insertion, and thought withdrawal. Stop. No other psychotic symptoms were discussed. Stop. On review of psychiatric symptoms, there were no notable symptoms of generalized anxiety disorder or social anxiety disorder, period. He has no symptoms in relation to obsessive compulsive disorder, and although Monsef identifies a history of interpersonal or relational trauma, he does not endorse symptoms consistent with post-traumatic stress disorder itself, period. Do you ever get the sense that other people can read your thoughts?
I hope so. Like,
What's that?
I don't know. I'm sort of a sci-fi fan.
Okay.
Like, I like all that sort of, hokey kind of stuff. Do I think that people can read my mind? I don't have. I've never had any proof that anyone could, right? So.
Do you ever get the feeling like someone or something is putting thoughts in your head or taking thoughts out of your head? New line. Mr. Monier arrived on time for his appointment, he was dressed in clean, weather-appropriate clothing, period. He was settled throughout the appointment with no evidence of abnormal movements, stop. Speech was normal in rhythm, rate, and volume, stop. As we start to get to have to wrap up today, how do you feel like this went for you?
Well,
thought form was organized, and goal-directed, period. Thought content revealed no delusions, there were some mild overvalued ideas as noted above, there were no auditory hallucinations and no visual hallucinations, period. Insight and judgment were deemed to be good, period. Is that something you've tried to think about before?
Yeah, like it's at the core of like my first episode where I thought I had this connection to the girl I lost my virginity to, with whatever you want to call it, and that maybe there was some sort of connection from my past, and that my parents knew about her, and that I would lose my virginity to her and stuff like that.
The Ebola of my lifetime drains and drinks the martini, devouring the soul of women, sucking every drop. The virus, stewing in putrid shit, still has the nerve to give a receipt at the end of transaction. A toxic debt it owes the lifeless masses.